Hello, everyone. I see a lot of participants joining in. My name is Vandita Morarka. I'm the founder and CEO of One Future Collective, and I will be your moderator today. Thank you so much for joining in with us, all of our participants, all of the panelists. Before we begin, today's webinar looks at domestic violence during COVID-19 and what civil society can do to address this pandemic within a pandemic. Just to bring your attention to a couple of housekeeping guidelines before we begin. At the bottom of your screen, you can see the option of interpretation, which allows you different language interpretations live during the webinar. It's available in French and Spanish. I hope you've all made a note of the different interpretation options that you have available. If you still have questions, we'll show you how you can engage with us and also ask us questions that are more technical in nature. The different ways in which you can engage with us during this webinar are, of course, by asking us questions. At the bottom of your screen, you have a Q&A box. You can ask any question for the panelists there. And every participant is encouraged to add their questions directly over there. Having said that, I would encourage everyone to extend the same respect and empathy towards panelists while asking questions as we would want to extend towards each other. During this conversation, you can also engage with us on Twitter. Use the hashtag #CivicIsDigna, as you can see on your screens. You can provide input here, you can share your organization's resources, and you can also ask follow-up questions. We additionally have a call to action that I will expand upon at the end of today's webinar. This is a way for you to engage your local media on domestic violence and to share local resources and helplines with the same hashtag to ensure that we're able to build collective action against the domestic violence crisis that's affecting us all over the globe. Lastly, you can also join the Digna Facebook group. You can see the link on your screens. Again, if you have any questions regarding this, you can get in touch using the Q&A box as well. We realize that these conversations can be slightly triggering and they may bring up feelings that are associated with trauma. If at any point this conversation becomes very difficult, feel free to disengage and also contact a support professional. Additionally, you can see a link on your screens. It's the UN Women Global Database on Violence Against Women to find a compilation of resources that would be relevant for your country. It's also being shared in the chat window for you all to quickly click on. Lovely. I'm very excited about getting started. I see that the participant number has been increasing. It's important for me that so many of us join in because that means we're holding space for and recognizing that this is an important issue that needs addressal. Hello, everyone. Quickly reintroducing myself because interpretations are on now. My name is Vandita Morarka. I'm the founder and CEO of One Future Collective. I'm also a lawyer and a policy consultant. Before we begin, I'd love to introduce you to my fellow panelists. You can see them all come live one by one. It's a brilliant cohort of activists from across the world who work very deeply with communities around issues of domestic and other violence. To start off, we have Roshika. Roshika, I'd love for you to say hi. Okay, I will come back to Roshika. We have Addobbati. She's the CEO of Social Good Brasil. It's an NGO that leads the local chapter of the movement Data for Good. She's also the founder of Women Friendly, an initiative that uses education to fight against sexual harassment. Additionally, she's also a member of Digna, the group that is bringing you this webinar, and a voluntary board member at MAG at Civicus. She's also the ambassador in Brazil of Human Rights Monitoring Initiative. Thank you for joining us, Anna.
Thank you, Vandita. It's a pleasure to be speaking with you. Good morning from Brazil. It's 8 a.m. here. So I'm looking forward to spend the next hour with you guys.
Thank you, Anna. Next up, we have Dumi. Dumi is proudly Pan-African and is unequivocally non-binary, queer feminist, working on eliminating barriers between grassroots experiences and global policy making. How lovely to have you, Dumi. We'd love to hear a quick hello.
Thank you very much for having me, Vandita.
Thank you for joining in. We also have Lucky. Lucky is a Ugandan feminist working with Raising Voices, which hosts the GBV Prevention Network. The network coordinates activists and organizations from East, South, and Horn of Africa for a stronger and politicized feminist movement. We'd love for you to say hello.
Hi, I'm glad to be here, excited for this space.
Thank you. Thank you for joining us, Lucky. Lovely to have you. We also have Uttanshi with us. Uttanshi is the Senior Program Officer at One Future Collective. She has a keen interest in understanding formal legal processes, their accessibility and role in ensuring justice for survivors of gender-based violence. She's currently pursuing a degree in law and is passionate about working within the human rights sector and exploring the meaning of alternative forms of justice in context of conflict and violence. Thank you, Uttanshi.
Hi, Vandita. I'm very happy to be here and excited for the conversation.
Hi, Uttanshi. Thank you for joining us. I'll also quickly introduce Roshika and have them say hello when they join in. Roshika is a Fijian feminist activist working in the Pacific region, and she's the Pacific coordinator of 1 Billion Rising and also works as a consultant in human rights, gender equality, social inclusion, and development. She provides support services to domestic violence survivors on a voluntary basis. Thank you for joining us, Roshika. All right, lovely. Is everyone set? We'll be starting soon. The format of the webinar will be me guiding panelists through a couple of questions, and we would love to hold space in the end for questions from the audience. Throughout the conversation, whenever you feel you have a question, feel free to leave it in the chat window, and we will address it at the end of the webinar. All right. This is a question that I have for everyone here. We've seen an incredible increase in the number of domestic violence cases across the world. We've been seeing data reports about it. We've seen governments talking about it. How has the COVID-19 crisis, and alongside that, the different forms of lockdowns that are being implemented in your countries, affected the domestic violence situation in your country? I'm going to ask Lucky to start us off, and I'd love to hear from each person what their local context has been like.
Thank you, Vandita. I just would like to say that, first of all, we have to acknowledge that this is new. This is something very difficult, and of course, nothing stays the same. So what has been bad becomes worse, or what has been worse goes to its worst. And maybe what has been good, well, slowly goes down to bad. So in my country, in Uganda, and generally in East Africa, the situation has not been so different from other places. We have seen the cases of domestic violence, especially violence against women, hike to numbers that are very, very difficult. Just to say that recently, the Minister of Gender in Uganda recorded 3,280 cases between April 28th and March 30th. This is just to say domestic violence has always been there in the country. It has been something we are working against, but with cases of women being trapped in houses with abusers, with cases of women who earn daily wages not being able to earn a living because of the lockdown. We have seen women who vend fruits, who vend food on the streets being arrested because of the lockdown. No one was supposed to be on the streets, but these are people who earn a living daily. They don't have salaries. So if they're not earning an income, they're depending on someone who is probably abusive. And just to say too that this is not just women who are on the streets or women who would think are going through those difficult situations alone. Even women who, for example, do research. globally, we have seen that there's been a drop on women submitting research papers. And this is because of all these new responsibilities, not new really, but enforced responsibilities, because now women do not have the space to go out to office. So they are bound to be home and doing domestic chores and handling the baby as they cry. So that space, that space in their mind to actually submit a writing is something that is very difficult. But the other situation that grew was that because of the lockdown, there was more likely to be more empty streets. So women are more likely to be violated by strangers they don't even know, because there's no one on the streets and it is dark. And so it's a difficult situation to say, and we are hoping that this will come down soon, and maybe before it actually does, we can find working ways to end this violence against women.
Thank you for sharing that, Lucky. I'd love to hear thoughts from you, Anna. Lucky, some of the points that you touched upon are extremely pertinent even in our context. We have seen the burden of care work increase, and I will reflect later upon how public spaces have become even more gendered in times of this crisis. Anna, I'd love to hear from you how the situation has been in your country.
So, hello, Vandita. Well, in Brazil, the domestic violence is hitting unprecedented rates. Latin America is one of the most dangerous regions for women. But what I would like to highlight is the use of technology and the support of civil society as a good and inspiring highlight in this contest. Recently, we found that the toll-free number used by the victims to report the cases to the police accounted of the increase of only 9% of domestic violence cases. But in Rio de Janeiro, which is a state of Brazil specifically, the police report can be filed online, and it reported an increase of 50% in the number of cases. It explains that when a woman is locked with her perpetrator, we have to find ways for her to ask for help in a more thoughtful way, understanding that there is no room for her to grab a phone and ask for help, and of course, they cannot leave their homes to ask for help. So recently, the Human Rights Ministry had released an app for survivors and neighbors to send pictures, videos, and call for help to the police bodies. It was a way of putting in place, using technology, a way for them to ask for help silently. And companies are also disseminating by WhatsApp strategic information for women who need to find a way to escape and save their lives and their children, because we have to take into account that when a woman is trying to escape from her perpetrator, she has also to take her children with her, and she has to go to the streets, and during this quarantine, it represents put them in risk. But it's interesting to see how technology is trying to find means to support these women in a situation where mobility is low. And often we know, at least in Brazil, that the local leaders were the ones who used to go across the slums, the communities, intervene, mediate situations, and support the community. So also one thing that I would like to highlight that was very important in Brazil is because the local social assistance office are still operating 24 hours a day, regardless of the situation of the quarantine. So local leaders are using speakers on the streets to draw the attention of the neighborhood that the support is still being provided to women and children, and activists are projecting messages on the buildings with the toll-free number of the police and other rescue lines and channels for receiving the announce. So, however, we know this is not enough because peripheral and rural areas are not being properly covered. We see that civil society and technology are playing an important role in Brazil during this crisis.
Thank you so much for sharing that, Anna. I think it brings up some very important points about what community-led organizations can also do in this time, and also about like mobilizing existing resources to be able to do something. I think even the points you raised about just access to be able to report is such a big concern at this point. Thank you. Uttanshi, I'd love to hear from you.
Thanks, Vandita. So even in India, similar to what Anna and Lucky have already mentioned, we have seen a rise in the number of cases being filed. But there is something that's different in terms of where these cases are being filed. For instance, earlier, a lot of the avenues where survivors reached out to were generally the local police officers or the local courts. That's where they went to get help and protection orders. But what's happening now because of the lockdown is that these police officers don't have the same capacity to accept cases of domestic violence, and courts are also shut down, which means that survivors don't have the same access to reach out to local police officers or other avenues of law enforcement. So, what that's doing is it's transferring a lot of survivors to the National Commission of Women, which is a central body functioning in India, which is currently taking on complaints from survivors of all forms of gender based violence. Now, the statistics released by the National Commission of Women also shows that there has been an increase. However, the problem is, like Anna mentioned, we're relying exceedingly on technology. And that means that to be able to truly get the picture of how many survivors there are or how bad the situation is, everybody in the country has equal access to that technology, which in India is definitely not a reality, given that over 60% of the women don't have that access to the technology, which means that we're not even including the 60% of women who probably want to file these cases but are unable to file them because they don't have the right technological know-how or the right technological resources that they need to do to file that case. However, having said that, what has been really positive in terms of the response that's being given to survivors is the real collaboration that civil society organizations, community leaders, and other individual communities, they're all coming together, collating a lot of resources, sharing them widely, expanding their services. So in that end, there has been some change in the kind of response that's given out. But at the same time, like I mentioned, the amount of outreach that survivors are getting in terms of legal help and protection is very diminished. And even though a lot of civil society organizations and individuals are trying to add their resources and mobilize their individual resources, I would say that they won't be sustainable in the long run until and unless the government intervenes and the government also either amplifies the resources that these organizations have or announces an alternative form by which these complaints can be processed. Because currently there has been no direction from the central government whatsoever, which makes this a very ad hoc procedure, which cannot last long, considering how long the COVID situation seems to be lasting. I feel like unless there is a proper response from the government, we will not be able to sustain any kind of support that's being provided.
Thank you so much for this point, Uttanshi. I come from India too, and I see this very strongly around us, where it's a big concern that there is a presumption of a certain amount of access, even in terms of addressing or designing solutions. And there is a certain dissonance in terms of understanding and recognition of the problem at the scale at which the problem exists. It's as though by ignoring it enough, it will go away. And I think that is something for all of us to be working on as well as civil society, and I will get to that with some of you later. Additionally, I think an important point that Uttanshi brought about, and I'd like others to reflect on as well, is how civil society at this point has truly been coming together to be able to design solutions that earlier we thought were not possible, or collaborations that we earlier assumed would not be ever possible. Thank you, Uttanshi. I'd love to hear from Roshika. And also, I want to take this chance to say hi to Roshika. We missed you in the beginning when we did introductions.
Yes, hi Vandita, hi everyone. Okay, so just adding on in respect to just the situation with domestic violence in Fiji and a lot of the Pacific countries, what has happened is that the curfews and the lockdowns have even made it harder for women to access police and legal services, especially for restraining orders, because there had been a lot of awareness on women accessing justice and accessing restraining orders prior to COVID. So this was something that was, quite actively being used or pursued by women, not with much luck, but it was being accessed and used by women. So a more darker, more sinister side to the lockdowns and associated curfews that has come by when we speak to women is that the perpetrators are intentionally ensuring that they cause the most harm to women, whether through verbal or physical abuse, is during the curfew hours, which is when they know that women cannot leave the house, cannot immediately seek help or access the support systems. The government and the police has also failed quite considerably, because there's been a lot of media conferences and a lot of media statements and so forth, but they failed to mention during these spaces that women can still access the police. Women still would be able to access healthcare services during the curfews. So there had been instances when women have been calling and saying, I want to leave right now, I can't take it anymore, but it's curfew and I can't leave. So there's been a lot of confusions about whether women can leave their homes to escape violent situations during curfews, which is either to seek help with the police or the support system. And perpetrators and abusers at home are aware of it, and they're also constantly monitoring women, because people were spending a lot of time at home during the lockdown period and also now during the curfews. So there's a heavy monitoring on women. So if she's using social media or internet, what is she using it for? If she's using the phone, if she's going out of the house, etc. So it's become even more dangerous and difficult for women. We've also had issues with obtaining DVROs that has placed women in direct precarious and at-risk situations because of the delay in accessing these services. And I think that another thing that's really important within the domestic violence context is not only the physical violence, that the different levels of emotional and financial violence that has increased. And this has all drastically affected women's overall well-being, safety, and health.
Thank you so much for that, Roshika. I think extremely important points raised. Also, the very need to look at domestic violence beyond physical or sexual abuse is something that not only do we not consider as much, but it's also something that our systems and policy measures don't truly account for, even when we are providing solutions. To give you context, when we are dealing with domestic violence cases right now, the biggest concern for us is that laws are ineffective because courts are shut, and most people need access to money to be able to exit. And that creates such a hindrance when we don't have solutions ready. Thank you. Dumi, I'd love to hear from you.
Thank you, Vandita. I think, as alluded, there are variant forms of domestic violence. And I think, the first thing that I'd like to mention is that, the Presidential Task Force is made up of 4 elderly men, which means that many communities have obviously been left out. We unfortunately had a loss within the community due to the pending lockdown, as I think in many instances, isolation is really more of a space that leaves you to many voices. And you find instances where people might have to navigate some of these voices. And now I'm obviously speaking about mental well-being. And I think it's very critical for me to mention that it's not necessarily that it's someone's own voice. It's really the voices that someone has experienced in terms of socialization, harmful traditional norms, societal expectations, family expectations. And, when you're looking at LGBTIQ young people, you're finding that domestic violence essentially has been aggravated. You find the instances where, the uncertainty around how economic recovery or even just economic responses amidst the pandemic is really now aggravating instances where individuals are not sure how to navigate not just trying to access health services because you need a travel permit, but also in the dignity of personal hygiene, because you find that SRHR commodities are not necessarily easily available, and not necessarily working means that you're further compromised in the ability to at least sustain yourself. I think it's really quite important to mention that a lot of the issues that queer young people have been experiencing are not unique to the pandemic, and in instances where we've tried linking with other response services, I think such as the Botswana Center for Gender-Based Violence Prevention and Support, you find that they're overwhelmed. And when you're finding a lesbian young woman who would like to seek shelter, is often then, it's a weighing of competing interests. So would you help a woman who is coming with 3 children, or one individual who is targeted as a result of their assumed sexual orientation or gender identity. And I think this is where the complexity has been, is that there have been limited resources, not just for civil society, but also in terms of response mechanisms, because the recovery plans or the provisions that are made weren't always considering civil society beyond food security. I think it's worth noting that the regulations in themselves aren't necessarily the problem, but more so to do with, for instance, let's say, attitudes of law enforcement when someone happens to present themselves with a variant gender expression that isn't necessarily normative. And you're finding that there are challenges with the ability to be able to, one, answer, why you're seeking essential services. Never mind the fact that internet connectivity is already a challenge with overburdened infrastructure and high internet costs. So you find that there are variant influences to the ability to connecting with community members who you've often belonged, and you had a sense of becoming your better self, and you're able to engage, particularly within the context of civil society mechanisms and spaces that were created to help strengthen efficacy and advocate for the rights of queer individuals. Civil society, however, has come to the party with the national the formerly National AIDS Coordinating Agency, essentially taking the lead and providing resources to civil society organizations to not just communicate some of the services and mitigation possibilities with the respective CSOs, but also to try and create linkages so that people are aware. For instance, people who are differently abled. When everyone now has to wear a mask, there's a need for individuals to be sensitive to those who would have different abilities. And I think, what's critical is that communities have been left behind as a result of the fact that a lot of considerations are largely decided by men, largely decided by elderly men. I'm not considering those who happen to be resident in rural areas, those who don't necessarily have cell phones to be able to log in to try and secure permits. And so I think all of these are influences to human rights leakages. And I think if I can just give one example is when we tried linking one who happens to be in the north of the country, an underserved area, to a center for individuals who've experienced abuse at home, it was very difficult because, one, the shelter couldn't necessarily take the individual as a result of not having space, but also there was a linking to the city council, or rather, let me say the social work department, which only aggravated the situation, and we had to find alternative accommodation for that individual. So, I mean, even as we speak, we are on 24-hour alert in instances where people reach out to us, and we have to provide the necessary support. And in some instances, it's just purely listening to someone, where someone needs an ear for someone who gets it. So I think there's so many variants that are often left out in statistics. There's so many variants that are left out in acknowledging and recognizing that previous harm can be triggered by lockdown precautions.
Thank you so much, Dumiso. Very important points. And it also leads me to my next question to you. I would love to hear from you on how you think civil society at this point can address the more systemic issues that have always existed and that have resulted in perpetuating domestic violence more so during the lockdown. And I know that you've touched upon the rights of queer persons during this lockdown, marginalized groups that perhaps don't have the same access, and also on mental health concerns. I'd love to know more on how we can address this from a systems perspective.
So I think there's a need to build evidence. I think that it's obviously really quite clear, and evidence that is owned, led by community members, and that's why we at Success Capital advocate for participatory research, and we've actually built some resources in acknowledging that there is harm at home, and in speaking to some of the economic, social challenges that queer community members are experiencing, and so that has helped inform advocacy messaging in different media platforms, just trying to raise some form of awareness for people to be a tad bit more considerate in light of the pandemic. What's important is addressing some of these human rights abuse leakages, and we've been working with Panellists, which is the Botswana network on ethics law and HIV and AIDS, which has paralegals across the country that has been able to at least provide infrastructure in instances where there might be a need for whether it's from an arbitrary arrest or a fine due to not necessarily having a resident permit. And then I think more importantly, especially now when we're looking at from a sustainable or rather long-term perspective, it's really about accountability and partnerships. And I think, when we look at the Botswana response, CSOs have definitely been left out in terms of being able to provide technical advice and at least be able to address some of the human rights leakages that I've spoken about. And I think it's really quite critical for us to identify where are the entry points in at least trying to facilitate conversations with different government departments or even the task force in trying to at least be considerate of the vulnerable communities or those who have been outlined. And I think, what's critical now, especially when we're looking, in the African context, we should be having conversations around the African peer review mechanism. We should be assessing universal health coverage and speaking to social protections, as Civicus has released a statement on social protection floors. And I think it's really quite critical for us to at least, not just learn from other regions and what's happening globally, but in also ensuring that, we're sharing the information with other CSOs and we're trying to link and bridge, because that is what ultimately will ensure that we're targeting some of these underlying issues that seem not to ever end. And I think, it's psychologically hemorrhaging to have to navigate economic, social, even self-efficacy issues as an individual. So you can imagine as a community, if you're not there to provide an alternative space, if you're not there to provide some level of flexibility. And I know, we've had a previous dialogue on youth resourcing and, sort of highlighting some of those impacts of COVID-19. But we must acknowledge that, a rapid response mechanism that takes up to 2 months is not so rapid. So these are some of the things that I think we need to then essentially ensure that we're bringing voice and visibility to in our various areas of influence.
Thank you so much, Dumi. I think that's extremely important. You've touched upon some great points, and I will allow for other panelists to reflect on it. I also want to ask Lucky a related question, which looks at what is civil society's role, according to you, during this challenge? And Dumi touches upon it as well, that how do we build bridges in the best possible way between different stakeholders? So this action is more sustained and it's not limited to certain communities or certain isolated issue solving.
Thank you, Vandita. Just to say that, like Uttanshi had said before, that of course now the burden on CSOs has increased because we have seen that the numbers of domestic violence have increased. We have seen that the numbers of specifically violence against women cases have increased. And so there's a lot on their hands, but also on the practical bit, there is so much they can do because most CSOs, most NGOs, most INGOs, really, most of the work they do is in communities. And now the communities have changed. So I think the beginning point is to know that you, as an organization, what is your purpose? What is your goal? Because the other thing we are seeing now is that most of the organizations are all doing the same thing because of COVID-19. So we are all providing the same helplines. We are all providing the same kind of response. But then we are leaving out, for example, if I am an organization that caters for children or for women or for these kinds of communities, how am I then going to apply an intersectional kind of way of doing things so that I am not, for example, looking at only women in this area so that all responses are not going to women in this area. We have seen a lot of interventions from social media, from a lot of technology, but so how about the women who cannot access these resources? So I think it is very critical for us to analyze our unique situations so that we can find interventions that fit our communities. But also to say that maybe to think more out of the usual way, processed way that we do things, because this is a pandemic, it's not something normal, it's something out of the normal. So we need to think of solutions that are not our usual structural goals, deliverables and outputs. We need to adjust how, and this will start with how we treat the people we work with. What are your expectations of them? For example, if my deliverables for this year were to reach this number of communities, how many of those people can I reach? Because now we badly want to reach our deliverables. We are saying we are going to do this number of calls, this number of Zoom calls, but our communities don't really even have internet. So we find that we are providing solutions to problems that are not their problems, or they have the problem and we're providing the same solution that does not help them. So just to say that we need, for example, I know of organizations that are providing what we are calling now the interpersonal response, to know that according to the values of your organization, the staff members interact with people, and because people, especially in most of the East African community, they know that you work in an NGO, they know that you work with a CSO, they know that you help people, so they will approach you as a person. And so they will, how about working with those people, your neighbors, for example? Why do we want to reach so many people when our neighbors, for example, when your neighbor is going through violence, what do you do? Do you know what you do? Because we have the helpline, but in the moment, you as the staff of an organization X, what do you do? So why don't we equip our staff to be able to handle like on-set issues? Because since this is a pandemic, we are all bound to go through different things. But also to say that, of course, not to underplay the role of social media, because we still need advocacy. And like Dumi was saying, most of the interventions that we are getting, the task force, even here, well, good enough, surprisingly, the task force in Uganda is mostly filled with women, so which is a really good thing, right? But we need more representation. We need representation from the youth. We need representation from differently abled people. We need, because, for example, what we have here is we don't really have enough intervention for people who are not what I will call the working class people. So if you have the people who are not in the field of very posh people who earn salaries, their lives are taking a different turn, because all our interventions are looking at this woman who has a salary and will at the end of the month have money. Of course, that woman still has problems, still has issues, and will still face violence probably. But there is this other woman who, for example, is not going to get the daily wage because she's being arrested on the streets. The other intervention for our women here by the government had been that the people who work in the markets should not return home until maybe the situation for COVID-19 has improved. This means that women, and it's mostly women who work in the markets, have been forced to sleep in the markets. These are women who don't have tents, so when it rains on them. They've been exposed to malaria. They've been exposed to more adverse violence from people they work with, from people who are on the streets. So how are we addressing that? Instead of providing a helpline to that woman, maybe we could provide a tent so that they don't have to sleep out in the open. Yeah, and just to say that online advocacy, like I was saying, is very important. Let's keep in touch with the decision makers, the task force. Let's make sure that the voices, our voices are heard out there. And just to conclude by saying that some organizations have what they call an emergency fund, and now would be a really good time, because it's an emergency, to reschedule that to COVID-19 in any way you can, any woman you can help. It would be very important.
Thank you so much, Lucky. Some of the points that really stood out for me were the role of personal leadership and just our role in our communities right now. And I love that you spoke about also protecting civil society and your own workers and people that work for you. And to remember that we might not have perfect solutions at this time, and we have to think of solutions from the point of our community and not ourselves. Thank you so much. Roshika, I know that you work in similar areas. I'd love to hear an opinion from you as well.
Yes, actually, I just wanted to add on and say that there's also a lot of, extra burden of work on civil society organizations, and at the same time, there was numerous discussions being had on the shrinking of the civil society space, especially in terms of funding. So what is also happening now that a lot of civil society organizations that were providing critical, service or frontline work, say for instance, lifeline supports like dealing with mental health and suicide, like acute mental health care, they've had funding that has been removed, and it has been redirected to other health interventions, without consideration for critical services like mental health. And this has resulted in them shrinking the mental health care services that they were providing. So whilst we have expectations of of civil society organizations, at the same time, I think we should be conscious of the fact that there is, funding that is limited. We're expecting civil society to do so much, but they don't have access to resources. The access to resources keep on shrinking, especially to very critical work, like for instance with LGBTIQ organizations, with mental health service providers, and we're already seeing the impact of this in many different communities in our different countries.
Thank you so much. That brings up very pertinent points for our context as well, where there is government advisory to direct any funding towards COVID relief efforts, and what is classified as COVID relief is quite limited. It does not, as I think Dumi and Lucky were also pointing out, account for the differential realities of different communities. And Roshika, I'd like to come back to you and also understand from you, how do you think we can address challenges that, say, LGBTQ persons face in terms of domestic violence, but also in terms of additional support possibly required for different marginalized communities, which could vary from mental health to housing or otherwise?
I think that before we even talk about domestic violence support for the LGBTIQ community during during COVID, we have to recognize that in countries like Fiji and a lot of the Pacific Island countries, LGBTI people don't go and report domestic violence because of the hostility, fear, and stigma that is still highly prevalent from service providers such as the police, the healthcare workers, and judicial services. At the same time, we don't have any supportive legislative frameworks and policies, that enable, that encourage, and that embolden LGBTI people to actually seek services or report domestic violence and seek related healthcare services. We have a very hostile political climate that also discourages the LGBTIQ community. So many cases go unreported, and this is pre-COVID, and we all are very aware that with COVID, with the lockdown, with isolation, with many other social variables, there's a higher risk for the LGBTIQ people, and not only in intimate relationships, but also from family members, and they also they're at high risk of violence and abuse from family members. And what we are also noticing is that abusive partners are sometimes using their partner's identity to exercise power and control. So threats of outing their partner if they're not out, or using other controlling techniques. Right now, at this stage, in terms of accessing domestic violence restraining order, it is near impossible for LGBTIQ people to be able to do that in intimate partner settings. Generally what happens, the police receive it as a physical assault case and not as a domestic violence case. And because it doesn't capture the exact or the exact context and the dynamics of the domestic relation, the way that it's addressed and the way it's processed, it results in a lot of injustice and delays, and a lot more stigma. So we don't have proper facilities accessible for the LGBTIQ communities. The other thing is in terms of domestic violence shelters, because we don't have LGBTIQ focused domestic violence services at all. It creates even more barriers for the LGBTIQ community to seek shelters, when they're in high-risk situations. The mainstream service providers are not, so there are mainstream service providers that are able to provide to a certain extent. However, there should be a lot more collaboration with some mainstream service providers. While having said that, one should also be aware that there's not even enough shelters, for instance, for women to be accessed. There's no government supported or sponsored or set up shelters available. CSOs are also struggling with the greater number of women that are seeking the services and with a very limited number of shelters that are available. Not enough funding to be able to expand the access to shelters. And if the LGBTIQ community don't see their reality reflected in the awareness and programs by mainstream service providers, they're not going to access it. They won't feel comfortable accessing this. One of the things that would have worked really well, because we are we're a country reliant on the tourism industry, so we do have a lot of empty hotels right now. For the government to engage and work and come up with a solution with these hotels and to repurpose these spaces for shelters during this time, and not only for the LGBTIQ community but also for women. However, we've not seen this kind of things happen. You also asked about mental health support to the different communities, and the mental health dimensions probably are the most ignored aspect of the pandemic. There are some very superficial mentions. However, there's been nothing done substantively. There's no substantial resources that have been allocated for mental health support, nor does it factor in the budget or come out as a strong policy action. The services, women's organizations provide crisis counseling services. However, consistent and psychosocial support is limited, and there's a lack of specialization for domestic violence or gender-based violence support. Helplines, we have helplines that are available. However, most of the helplines operate on a crisis response basis. One of the big issues have been that funding has been reduced for some critical service providers that were providing support services, say for example on suicide prevention services. The other thing that I do want to mention, something that would work in a context like ours in Fiji, is having mobile teams operating in communities to assist people with psychosocial needs and social priorities. Of course, taking into account COVID protocols, health and safety protocols. The mobile teams would have been a good decentralized effort to work in communities. We see this kind of model in use during natural disasters, post-natural disasters. However, we have not had this model employed during COVID in terms of providing psychosocial support to people. The other thing is that I think could work well is ensuring the coordination of welfare, of housing, of education with mental health services. So right now it's operating in very siloed ways, and because there's no unified assessment process between these agencies and mental health, there's no incentives for them to even pull their budgets together to work in close partnership. So we see that they're working in silos, and a lot of the time the kind of support that they're able to provide is also limited, and a lot of the triggers or a lot of the aggravating or contributing factors are not able to be addressed because there's a lack of coordination between these agencies. And these are some things that could have been done really well during this time, because there were different interagency groups that were set up by government organizations to address this. Finally, I just want to emphasize on strengthening community-based interventions for mental health services through forms of home support and care, and also engaging traditional leaders. Already traditional leaders and religious leaders provide some level of counseling. However, in terms of it being rights-based, has always been a concern, but working together with them in terms of accessing the structures that they had set in place and improving the quality and expanding it somewhat with the support of women's organizations, people that are trained in GBV, gender-based violence, mental health care, and crisis support. So these are just some of the multidisciplinary and community-based interventions that could have worked really well in terms of addressing the or enhancing the access of mental health services to varied communities around Fiji.
So much, Roshika. There were some extremely pertinent points. And it does throw light on a lot of what others have also been talking about in terms of the immense need for community interventions right now, and also how these are often a reflection of a lack of understanding of how issues are interconnected, and treating these issues as individual problems doesn't really ever lead to a proper solution. Thank you so much. In relation to that, it brings me to something that I've been wanting to ask Anna. Anna, I'd love to understand from you that at this point, how do we distinguish and address the unique challenges that the issue of sexual violence, both as a part of domestic violence and as separate from domestic violence, brings up during the pandemic?
Wow, thank you for the question, Vandita. Domestic violence, usually leaves marks when it's not in a psychological dimension. I say usually, But what I want to bring to the table here is that there is a level of awareness, and I think some of my colleagues have touched on it, how neighbors are being empowered and the community is empowered to understand when a woman is suffering from domestic violence, when they can identify there is a case, and they can call for help in the police. At least in Brazil, you can, the law enforcement foresees that a third party can really initiate the police investigation when they witness a case of domestic violence. So in this sense, I just want to say that there is at least some the community itself around that woman that was being affected by domestic violence is empowered somehow to to protect this woman, to look for the police and other ways to rescue her. Sexual violence is silent. And sometimes the partner does not want to take for granted the testimony of children, of adolescents who are suffering harassment or violence from parents, step-parents. So I just want to highlight how important it is to have a direct line to be in touch with adolescents and children, and also approach them, give them independence to reach out for help. So, for example, I'll give you an example. And again, as in Brazil, in urban areas, we are highly connected population. There is an app called Happy, that's a food delivery application that 15 days ago has integrated an emergency button for domestic violence victims call for help, for the help of the police. And surprisingly, they have received denounced of children and adolescents who are being abused, sexually abused by their relatives. And it, for me, just explains that we have to take the sexual abuse towards children and adolescents apart and find proper means to give them a way to ask for help. Sometimes, unfortunately, even the adults at home, they acknowledge the violence, but they just don't want to take a step forward to protect them. So touching also what my colleagues have said, and I know there's one question here in the forum about how local leaders can help on that. I know in some communities there is mobile teams. There was one case that reached out for me for help of one leader that was approaching some houses to donate food. And she was the one asking for the adolescents and kids how things were doing at home. And one of these cases, she heard that one of the adolescents were being harassed by her stepfather, and so she could ask help for the authorities to take this adolescents and protectors. So what I want to say that in this case of sexual abuse, we have to find proper means and give the chance for adolescents and children to reach out for us by technology or reach out to local leaders and find these ways, these touching points when we in this offline perspective, with these touching points where you can offer yourself as someone that can be with credibility and can provide them rapport to be reached out in case of sexual abuse and other kinds of abuse, of course.
Thank you, Anna. Some excellent points, even in terms of the crisis that is in front of us and that we're not being able to address. I especially like the solution that and what each of us can do to provide and extend support. Takes me to Uttanshi, and Uttanshi, I wanted to understand from you that, especially at this point, and considering what all the other panelists have been talking about as well, how can we improve access to justice and also community-based support for survivors during the pandemic? And I would like for you to also look at these solutions from the perspective of a marginalized community who may or may not have as much access.
Thank you, Vandita, for that question. But all the panelists have added some wonderful points. They've all been very context specific, and at the same time, they've found a way to connect CSOs across the world, considering that all of us have similar beliefs, similar value systems, and similar purposes with which we were established. But specific to access to justice, there's just something I'd like to point out before I dive in, is the fact that, and I think somebody on the panel pointed that out as well, domestic violence is not something that started after the lockdown. It's not a result of COVID-19. It's not something that is a consequence of, okay, so it didn't exist before, it's coming into the picture now because of the pandemic. It was always there. And even when it comes to access to justice, the system was in some ways always broken. And I think Dumi spoke about how access to justice is problematic, not because there is a gap within the law or, there is some sort of lacuna within the law, but because of the fact that there are other structural systematic changes which need to happen in order to make access to justice truly possible. When it comes to the role that civil society organizations can play during this time, and I know a constant recurring theme that has been running through the entire panel is the fact that there is a need for increased collaboration between different CSOs. And there's a small guide we put together at One Future Collective where we spoke about how different stakeholders can respond to cases of domestic violence and the increase of domestic violence. And one of the most important things that came forward when it came to how CSOs can support survivors mainly is the fact that different CSOs have different capacities and different CSOs have different specialties within which they work. For example, if my organization can provide legal support, another organization is more equipped to provide financial support, another organization is more equipped to provide medical support, another organization can provide better shelter to survivors. So what's important, I think, is instead of individual CSOs to try to increase their potential and increase and stretch themselves and try to give all resources and all services by themselves, it's important to invest in really collaborating with other organizations who provide a wide form of services which can help us give comprehensive support to survivors who reach out to us. For example, my target audience, so people who reach out, who call our helpline specifically, may not be the same people who may be aware of other helplines, who may not be aware of the work that other CSOs are doing. But we have that privilege. We know that within our community, we know some other organizations are more suited to do that. We know other organizations have more capacity to implement and give the kind of support. In such cases, it's important for us to not just collaborate with them, but also to act as the middle person and to ensure that I give the person who reaches out to me a personal contact in the other organization, because that reduces steps. For example, the same kind of problem that the person faced in reaching out to me, I can delete all those steps by being the middle person and ensuring that instead of asking them to and directing them to a common helpline, I can give them a personal number saying, go to this person. I've already spoken to them about what's happened, and I've already discussed possibilities by which we can assist you. And that helps us not only reduce the steps, but also increase confidence that the survivor may give and put in us as an organization. Another thing that I think is also very important is, I think Lucky mentioned about the importance of investing in community building and investing in individual safety champions and really building capacities. There are so many ways that as individuals, we can intervene directly and provide support that A lot of CSOs may not have the same capacity, but we do have a capacity to train individuals to identify their capacities, to identify their potential in providing support to survivors. And this includes very, very basic things like training them in bystander intervention, talking with association owners and understanding and helping them realize their capacity in supporting survivors within their own communities, and talking with doctors and understanding how they can give more support to survivors themselves, and how beyond just medical support they can actually report the crime on behalf of the survivor, so on and so forth. When it comes to marginalized communities, I would also like to say that there are different ways by which people are being marginalized, and they have always been marginalized. But currently, the biggest factor which I think contributes the most negatively to marginalizing a particular individual is their access to technology and digital literacy. Given that a lot of people are trying to move their services online, people who don't have access to this technology, people who don't have the awareness to use this technology, are being marginalized in a way that they haven't been so far. And this unpreparedness is not something that we have the capacity to answer. We don't have the capacity to build on it, and we don't have the capacity to respond to it immediately. In which case, I think it's also important to understand how state agencies can respond better, and how state agencies, for example, even police officers independently, can develop programs which are completely and easily implementable by them, but may not be being done because of the fact that the government is not forthcoming. For example, one of the states in India, they've launched a very effective program when they say that all the police officers will give a call to all survivors who've reported a case of domestic violence in the previous 6 to 8 months. That goes a long way in not only keeping a check on the abusers, but also reaching out to the survivors, letting them know that we are still functioning. You can still reach out to us. And things like that, right? It's very simple things. It's things like the police can ask to patrol different areas and even just speak on speakers. They don't even have to go inside individual houses to let them know they're there. All they need to do is go in their vehicles with the sirens on and just patrol different areas. Additionally, another thing that they can do is really input on bystander intervention and these trainings are definitely something that CSOs can do. But at the end of the day, like I mentioned, we do have limited capacity and we have limited outreach. But when the government takes on things like bystander intervention, when the government starts pushing for it, there is true potential for a large number of people to understand and harness their individual capabilities, which can by itself play an important role in providing support to survivors.
Thank you so much, Uttanshi. I think that's extremely important to think about what we have capacity to do right now and what are just not going to be possibilities. And then building upon our personal strengths and organizational strengths to develop a collaborative model that can truly address this problem. Thank you so much. Roshika, I'd love to know from you about, you were mentioning related to what Uttanshi was saying about the provision of laws and their applicability in your country. You need to unmute yourself. No worries. Roshika, we can't hear you. Do you want to try connecting your audio again? No worries. Till we fix Roshika's connection, we'll probably have Roshika send in her thoughts on chat. I'd love to know from someone if they have thoughts also about how technology and access are particularly playing out in their context. And in the long term, in the short, medium, and long term, what do they think could be possible solutions for it? Anna, would you like to maybe add something to this?
Well, I do believe in the power of civil society to tackle some gaps where the states are not being effective. I think here we have addressed how rural peripheral areas are not being properly covered by technology. So first of all, if we think in the long term and we understand that technology is a powerful tool for support minorities, vulnerable ones, how can we join forces for cover in the most proper and comprehensive way these areas that are being excluded? This is one approach. Another approach is really being empathetic, because it will take some time for technology to reach out all those areas where there is no access to technology. Also, that's what we call tech literacy. Sometimes you have access to Wi-Fi, to internet, but you don't know how to deal with technology. So how are we introducing these vulnerable people to technology properly so this can be really useful for them when asking for help and asking for support? Another topic that I'd like to address here, and I need to also one question for the forum, as we know that one day this crisis will pass. And also we have to understand that domestic violence starts in a cycle that comes before the physical violence itself. So understanding the psychological and also oral aggression, violence, it's the beginning of this cycle. So how can we empower women, LGBTQ, adolescents and children to understand the beginning of this cycle and start asking for help from its very beginning, and asking support and intervention before it comes to, unfortunately, sometimes even death. So I think technology, in summarizing, I think technology is important, but it's not comprehensive enough. I think we should work as a civil society to fill these gaps, together. Also understand that there is a gap for tech literacy. We have to understand how to make this more democratic as possible, accessible as possible, but also providing key information about how to identify how domestic violence is triggered by psychological and also oral violence.
Thank you so much, Anna. Very pertinent points. I do especially think that understanding how domestic violence plays out and then building possible interventions is a great step to starting to address it. I'm also particularly interested in what are low technology solutions that can still be rolled out. I know of cases in India where perhaps we're using text messages to stay in touch. Other ways to stay in touch which are low tech intensive. Dumi, Uttanshi, either of you would like to add some thoughts?
Thank you, Vandita. I think, it's really, when we speak about internet access and internet governance, it's really a bit of an issue. And the fact that, when you're looking at a country like Botswana that is going to be very reliant on the fourth industrial revolution in terms of its development aspirations, we can see that there's significant shortcomings. And to some extent, obviously, there are private sector interests, but also I think we need to address the fact that, Africa in itself is significantly not necessarily connected. If I can share some stats around Botswana, we have over 160% cell phone penetration, which means that at least a majority of the population have access to phones. And what we are actively doing at Success Capital is providing airtime and data to help connect individuals, particularly young people, and not just necessarily LGBTIQ. Because we've noticed, or rather that we've realized that in as much as individuals need to be able to connect on social media, sometimes it's not enough. And the ability to at least have a discussion or to chat, even within a virtual space that does have some level of intellectual stimulation, gives some level of hope amidst all the uncertainty. And I think, it's really quite important for us to speak about the fact that there are elements of cyberbullying, there are elements of backlash, especially in instances when we are trying to highlight and communicate precautions that are specific to, or that rather help and address some of the challenges that community members might have. And I think it's really quite important for us to at least be able to provide tangible means for someone to be able to connect and be able to at least speak to someone. And I think, it's also quite important to at least provide a space for individuals to imagine what a post-COVID reality would look like. In as much as people speak about, maybe new developments in terms of whether it's narratives around vaccines, it's narratives around, new cases, I think it's really quite critical for us to start having conversations around what does the post-COVID economic, social, and Botswana, or even Africa look like. And I think it's really, this is where, when we talk about civic participation, it's really quite critical. But I also must, just speak to the issue of state of emergency regulations do end up limiting freedom of expression, particularly when you're speaking of anything or you're mentioning anything around COVID-19. And I think this is a critical point where, obviously a lot of people don't necessarily know. And it's for us, it's ultimately CSO's responsibility to actually take up that mantle in sort of informing individuals and hopefully not necessarily having human rights abuses go beyond just issues of violence and exclusion. I think, more importantly, it's really now speaking to building infrastructure for solidarity. And I think for me, what I've then learned is that, where you don't necessarily have a strong intervention or program, it's okay to rely on a partner. It's okay to rely on others and ask for help. Botswana's main public hospital had actually closed down its psychology department, and mental health issues are significant. So you can imagine in an environment where there's a lockdown, there's difficulty with navigating regulations, it becomes even more complex for an individual to seek mental health support, because in many instances, if it's a tertiary institution, then they're only allowing counseling services for those students. If it's primary school students, same thing. So I think it's really quite difficult and complex in that there are certain checkboxes that are really quite prevalent in colonialist development that are still dictating emergency responses today. And it's really quite critical for us, especially when we understand that, when it rains, it pours and it affects everyone, so too must we understand that solidarity should be like sunshine in enabling everyone to at least thrive within the context, whether crisis or not.
Thank you, Dumi.
Thank you so much. Thank you for sharing that. Yes, Suhani.
Nope, was just checking that your mic was working, Vandita.
Thank you. Uttanshi, I'd also love to hear some thoughts from you. Dumi touched upon extremely important points, which I find are also true for the Indian context.
So, Dumi, I loved everything you said, especially that point where you said we have to build infrastructure to foster solidarity. And it's important to understand why and how we can do that in a situation where it's seeming more and more unlikely that we're ever going to be able to go back to a world where we were able to have the same amount of physical contact and physical interaction with other people. And what that means for survivors specifically, right? Especially in cases where we earlier used to reach out to police officers, or earlier we used to reach out to courts. What are alternative aspects that we can invest in and we can explore currently that can be adopted even later on? For example, just a statistic that I want to share is the highest court in the country, which is present in the northern part of the country, is only accessible, like the number of people and the demographic of people who are able to approach the highest court is much lesser from the southern part of the country, which means that there is a problem with access to justice, even in situations where there is transportation available, even in situations where there are no government restrictions on movement or on accessing courts in different parts of the country. So what that means is this could serve as an excellent opportunity to really invest in a system, an infrastructure of justice delivery where we're relying exceedingly on the internet and using no contact justice delivery systems. But at the same time, that brings us to the next question, which is what does that look like in a country where access to technology by itself is highly diminished? Like I mentioned earlier, only about 38% of women in India have access to justice, have access to technology, which means that every time we say we want to focus on increased and better justice delivery, we have to, whether we like it or not, we have to focus on increasing access to technology. We have to focus on increasing digital literacy, which right off the bat seems really tough to happen immediately, which is why I think some important ways to address the situation right now and then to move on to greater structural changes would be to, one, really help grassroots level organizations understand their own potential and capacity in supporting survivors. For instance, we have a lot of building and apartments, and how can these apartment owners association come together and address the concerns that survivors may have? Now, that is something that we don't need technology for. That is something we don't need access to telephones for or access to the internet for. What we are doing there is building capacity within a restricted area which means that there is no increase of contact, while at the same time ensuring that there is safety and protection being mentioned. Another thing that is also trying to be explored nowadays is the fact of using media that's transferable without the use of the internet or with lesser use of the internet. For example, transferring techniques of capacity building, etc., via audio means and not via the internet so much, because then there is greater accessibility of that information.
Thank you, Uttanshi. That's been extremely pertinent in our context, where the language variation is also so much across our country that audio-based content makes it really easy to disseminate information. And something that sprung up during the more recent feminist movements across our country was the use of tools and apps that allow you to share data without any internet access. All it requires is for your phone to have Bluetooth and for enough number of people around you to be using those apps. So perhaps looking at how that can be integrated and think of that as a solution in terms of COVID-19 responses. Thank you so much. I'm very grateful to all the panelists. I know they've been raising some extremely pertinent points. I'm going to take a final comment from Roshika on this question, and then we'll look at some audience Q&As.
Yep. Hi. Sorry about earlier. So in terms of access to justice, I just wanted to highlight that in Fiji, our domestic violence legislation is relatively a good piece of law, and it has some excellent provisions that can enable access to justice for women, especially now during COVID. But since the implementation of the domestic violence legislation in 2009, this provision has been barely used, if at all. For example, one of the provisions in the legislation says that a prescribed police officer can apply for domestic violence restraining order via telephone, via telephone. And this could actually mean life and death for women who are in very high-risk situations. However, this provision is not being utilized, especially at a time like this when court services are reduced, with the heavy arbitrary criminalization of COVID, police officers are more occupied and busy with checkpoints and maintaining curfew and so forth. The other provision in the same legislation is an additional condition for restraining order in terms of urgent monetary relief, which can be an additional condition to the domestic violence restraining order. And this can be in the form of a lump payment, or can be a periodic payment, or can be in kind. And this, again, this provision has not been used, or even perhaps used a couple of times, if at all. And this kind of provisions in legislations or policies are of critical value in emergencies or situations like COVID, since applying for regular maintenance would take very long, and more so in limited judicial operations. But once again, the police are unaware of its existence. There has been no effort undertaken to establish coordination with the judicial officers in terms of applying for the DVRO, and police actually assisting women to complete forms. And if they're not aware of additional conditions that they can put, taking into consideration women's context, such as urgent monetary relief, it creates a higher burden.
Thank you so much for sharing that, Roshika. To me, it also brings up points.
So these are so in terms of legislations.
Go ahead. There seems to be a lag.
Sorry, I think there's just a delayed connection. But yeah, fine. Vandita, you're all right. Please go ahead.
All right. I just wanted to touch upon how your points make me think about the need for our systems to change in terms of the police or the judiciary, exploring options of virtual courts or being able to call in an FIR. I think Anna was also mentioning earlier about being able to report online and how much that changes reporting percentages, access to reporting, and what other means can we think of. Increasingly for me, especially in my context, it also brings up parallel questions of data and privacy, and how much of that are we willing to let go of when we're thinking of solutions that are very tied into our everyday technology use. Any further last closing thoughts on these points from someone? Otherwise, I'd love to maybe summarize and take some Q&As from the audience. All right. Just to summarize a couple of points that the panelists have been brilliantly talking about from the beginning, I think there's a definite need to understand that these problems are not unique to the pandemic, or they're not created by the pandemic. They have just been heightened by the pandemic. And which is why there is a need for us to develop systems and structures that outlast this pandemic and that actually create shifts in how we function and how we provide access, support, resources, and just infrastructure to address these issues from the prevention stage to the redressal stage. I think there's been a lot of really interesting conversation on technology and access and how tech-based interventions can be a possible solution. But what I've really enjoyed is listening to how each panelist comes with such unique experiences of what is working in their country and how community-based interventions can be so different but still so similar in terms of how they can be rolled out and the potential for access that they have. So thank you so much. I will take some audience Q&As and direct it towards you all. And then we have a special call to action for you towards the end. Give me a second. So we have a question from Charles, which asks, how can grassroots human rights defenders organizations ensure protection to human rights defenders working in the prevention of gender-based violence and who may be facing threats that jeopardize their work? I'd love to hear reflections on this from Dumi, and then anyone who wants to pitch in, please do.
Thank you, Vandita. I think, I have definitely touched on it. I think the fact that there are limited resources, the fact that, lots of grassroots organizations aren't necessarily part of structures, I think it's really quite helpful to understand, one, the needs and the interests of the communities that you're serving. And then I think what's really quite critical is putting a lot of work in terms of trying to seek out resources. What we've learned is that we're able to either leverage or request in-kind resources where suppliers can be paid for by different partners in lieu of receiving funding directly, as well as trying to at least establish some form of credibility with other CSO actors who can be able to assist or at least create the pathways to securing further resources. I think for us, especially when we're acknowledging the fact that we've got limited human and financial resources, the critical work is really in being able to link and bridge, especially when it's an emergency situation. And I think, for us, the biggest asset that we have is the ability to be able to respond to needs regardless of contact hours. And I think for us, and then also canvassing and acknowledging that, there's so many different virtual partners, especially when we're speaking to mental health provision, that we can end up sort of seeking help from. I mean, if I speak about Digna and the ability just to be able to reach out and say, okay, hey, I've got a very, very serious problem and I need some assistance. Usually you do then find someone is there to share and at least to be able to extend some form of solidarity in kind. So I think it's really quite critical for grassroots organizations to not only just ensure that the interests and the needs of their communities are central to any possible response mechanisms or grant applications, but it's really in trying to reach out, because I think, it's collaborative partnerships that really help mitigate some of the limitations that CSOs might have. We don't necessarily have all the answers, we don't have all the resources, but we can definitely at least reach out to those who are willing to support and at least extend solidarity.
Thank you, Dumi. Any other panelists who would like to pitch in? All right, lovely. I have a question directed to Anna from Reshma. She asks that how do local elected representatives or local leaders, how can they play an important role at the local level and ensure access to various platforms in the context of gender-based violence?
As I was saying, thank you for the question. As I was explaining before, I think when you're in an offline perspective, if you were the person that has this kind of connection with the survivors, with adolescents and children, be sure to be available during this pandemic to have touch points with them. How you can approach them, if you're part of a mobile team, if it's possible, of course. When you're donating food, say like, do you want to talk to me? Do you want to reach out for me? Can we talk a bit? It's one thing on an offline perspective. But when you come to a digital perspective, How are you dealing with communities around you? Do you have groups in Facebook where these people can talk and share their thoughts in a safe way? Do you create safe space in your social media for Instagram or Twitter for having private conversations? How are you available and present on these platforms? Because it's again the sense of community, of being there and easy to be accessed by these victims. I don't know if I answer your question, but thank you so much.
Definitely, Anna, thank you. There is a lot of power in being just present and holding space for other people. Thank you. Owing to time, I'm going to take one final question. It's from someone who's anonymous, so I don't know their name, but I'd love for everyone to share closing reflection, because I think this ties in together what we've been thinking about as well. That will domestic violence be looked at in the same way after COVID-19, or will it become even more important to address the issue in a better way? Perhaps we can have Lucky take the first round.
Thank you, Vandita. That's a very interesting question. On some days, I would like to believe that after we have gone through all this and we have seen what women go through, we have seen the plight of domestic violence, that maybe we shall focus and refocus our attention. But I think it's important for us to understand that however much the pandemic has put this much pressure on women, maybe it might be too early to put our expectations too high, because understanding violence against women is understanding the power dynamics that happen in that kind of relationship. And that takes attention, that takes special attention. That's not just seeing women being battered, that doesn't take a lot of numbers. If it shouldn't have to take numbers for us to pay attention to violence, because then that worries me. Because how about the women we never know about who experience violence? I don't think that the issue is we needed like a highlight or a torch into how much women suffer, because women have been going through domestic violence, that's true. They've been going through economic violence, that's true. They've been going through physical violence, that is true. And all this while, we have kind of looked at violence the same way. So I don't think that after all this, there'll be like a magic bullet that says, yeah, we have nailed this thing, it is not going to happen anymore. I don't think that's true. I think that after COVID-19, looking forward, we will just have so much to work with. We'll have so much support to provide for the people we love, for the people we don't know, for all the women around. We shall have a lot of understanding to do, empathy, because, and that will not come out of a place of seeing how much physical violence has happened. It should come out of a place of understanding how violence happens. And I don't think that that understanding comes from a place that the pandemic is providing. I think the pandemic is only providing an opportunity for us to exercise empathy, to exercise understanding, and maybe to be able then to highlight more what domestic violence means. Because even after the pandemic, it won't stop. Just because women are no longer trapped in their houses, just because maybe some life has presumably gone to a bit of normalcy, doesn't mean that domestic violence will stop. If we still have patriarchal structures, if we still have these damaging stereotypes, which are not going away because of the pandemic, if we still have these destroying tags we give to women, then the pandemic is not going to solve a lot, really.
Thank you so much, Lucky. Yes, we'll take Anna next.
It's just, I make Lux's words mine, but I just want to highlight that after this pandemic, there will be economic crisis, global economic crisis. And usually minorities and women are the ones who lose the most. So we have to understand that to interrupt the cycle of violence, empower them economically is also important. So I just want to highlight this. There is another dimension of this crisis that we should address after the pandemic to really support these survivors to really disrupt this cycle of violence. That's it.
Thank you, Anna. That's extremely important. Roshika, would you like to add something to this?
Yes, I think one of the things that COVID definitely has brought up to the surface is the way the violence exacerbates or gets aggravated during emergency or during certain contexts and situation. However, in terms of better response or more resources being put towards primary prevention of gender-based violence, I don't think I would like that to happen, but I don't think it's going to happen because all of this still requires political will. It still requires the government in power to show political will, to allocate resources, because civil society organizations will not be able to sustain a lot of these strategies on their own. They need the support of government to be able to implement it well. And right now, even during COVID, we are not getting the full support of government to domestic violence issues. So even post-COVID, it's still going to be a struggle. There's still going to be a lot of resistance, a lot of work, a lot of civil society organizations, feminist and women's organizations around the world that will continue, to advocate on this. So whilst I'm trying not to be too pessimistic, but that's the reality, unfortunately.
Thank you. Thank you for sharing those reflections, Roshika. Uttanshi, is there something you'd like to add to this?
Yes, both Lucky, Anna, and as well as Roshika have really touched upon what structural challenges are going to surface once the pandemic subsides, sort of. But something that I would like to add is the fact that, we've always suffered, we've always faced trouble with backlog of cases within courts. We've always struggled with overburdened police officers. We've always struggled with overburdened legal systems at large, which means that justice in whatever small way was always accessible only to a small percentage of people who actually want to access it, which goes to say that that's only going to get worse once everything opens up slowly, and it's only going to be tougher for people to reach out and access justice. Having said that, something that has definitely shown a lot of potential for me personally and the work that we do within our communities here is the sheer amount of unused potential that we hold in ourselves as individuals and as communities in how we can provide support to survivors. And I think this lockdown and the whole highlight that domestic violence has gotten, which it didn't get for these many years, has really provided the opportunity to harness that potential and to ensure that we all really understand our individual role in supporting survivors and to really hold space for them in our personal interactions with them. So I'd say that to sum up what I'm saying that the formal legal process system is going to be really severely hit. And I don't see that there's going to be too much of a change there. I'm not very optimistic about that. But at the same time, I am very optimistic about our own understanding of where we stand and our potential in providing support to survivors.
Thank you for that, Uttanshi. Thank you. Dumi, I'd love final reflections from you.
Thank you, Vandita. I think it's really quite critical, and to echo everyone's sentiments, I think it's really quite critical for us to understand, especially within the African context, that violence has been really quite prevalent, and we've learned of it in previous epidemics and pandemics. I think even globally, we know that there was a Spanish flu, but for some reason, it seems like we tend to forget with history, and that's the same challenge with social justice. We find in many instances where there might be, like for instance, 11 June's decriminalization case in Botswana, it doesn't necessarily mean that involves protections. It doesn't mean that it involves equality before law. And even though we have got other issues such as marital rape, we've got other issues such as triggers from sexual violence in your early childhood years. These are the triggers that we don't necessarily unpack and uncover or even heal within society. So I think, what domestic violence really depends on is a feminist lens. It's rooted in decolonizing knowledge and acknowledging and recognizing that community is very central to the experiences that dominate society today. And I think what would be critical for us is to acknowledge and understand that all community members need to be included within, whether it's health, economic, and other responses. And I say this because, you know, sex workers are still members, so critical to providing certain services that are often seen as essential for their clients. Similarly, when we speak of individuals who are in an informal economy, and you know, in many response measures or precautions that have been made, we haven't acknowledged the perpetual violence that these communities have experienced, especially with law enforcement being brutal. It has just only illuminated the inequalities that exist in society today. So definitely, I feel like this is only a start. And the fact that we're scratching the tip of the iceberg, there is a need to root civil society work, solidarity, and anchor work within the context of the last mile forward in health, within the context of leaving no one behind in sustainable development, and safeguarding the rights of communities by ensuring that they can actively participate in their beauty and their diversity.
Thank you for that, Dumi. Thank you so much, everyone, for joining us, all the participants and the panelists. I hope this has been a learning experience. I feel like I'm taking away a newer perspective on how we can address domestic violence in our communities. And I hope that's something that other attendees and other panelists take back with them. Before we end today, we have a final call to action for you all, because we don't want this conversation to stop with this dialogue. We want to see how we can take this conversation ahead back in our communities, leverage the power and access that we have to technology and social media. It's a very small call to action, and we're hoping that everyone can participate. Tomorrow, May 15th, is the International Day of the Family, and domestic violence occurs in families. And while we've covered a lot of ground in terms of intimate partner violence within families, domestic violence can manifest in multiple different ways as well. And tomorrow, we would love for you to shine light on that. Engage with your local media, share local resources and helplines with the hashtag #Digna, so that we can also amplify your resources with our international community. Anything that you think is helpful for survivors of domestic violence, or solutions that you think could be implemented, localized, and contextualized for different countries, we're very happy to hear from you. We want to ensure that this is not the stop of a conversation, but it's the start of a larger conversation and more action in our communities, and also a pathway to more collaboration. Thank you so much for joining us. Hoping everyone stays safe and well during COVID-19. Thank you. Take care, everyone. Bye.